Hello class, I'm going to lecture on Chapter 1. In addition to Chapter 1, I'd like to give a very brief history of medicine. On this slide, you'll see a timeline of medicine, and in no way do I expect you to memorize the dates for certain scientists and theorists that are listed here. I just like this timeline because it helps me to visualize which of these people were the prominent scientist/physician in each era. Many of these individuals are discussed in the YouTube videos I have posted for this week on the history of medicine. In this PowerPoint, I will highlight just a few of my favorites, but I don't want to spend too much time on them as the YouTube videos are more interesting than anything I could ever tell you, and that might be very well true for the entire semester. I'd like to start with Hippocrates and discuss a little bit about Hippocratic medicine. There's a medical book called the Hippocratic Corpus. It actually consists of about 60 or so textbooks within this book, and it is attributed to Hippocrates, but we know he did not write all of them. It was written over about 70 years by several individuals who were physicians at the time, and these works were collected in Alexandria and Egypt around 420 to 350 in an era known as the, quote, before Common Era, or BCE. Before the Hippocratic Corpus was written, diseases were believed to be caused by the gods when they released their wrath on the people. When the Hippocratic Corpus was written, it was a time when physicians believed that diseases were not caused by wraths or gods, but instead diseases were thought of as an imbalance of bodily fluids or humors. If there was a balance of the humors, this was called eucrasia. If there was an imbalance, then this was called dyscrasia. The physicians during this time of Hippocrates used systematic observation of the person who was ill. They tried to take a history from the patient, and a physical exam of the ill person became their primary focus during this time. Many medical and surgical treatments were introduced, and it is believed that Hippocrates was actually prescribing aspirin in some cases. Man's four humors were identified as black bile, blood, yellow bile, and phlegm, all of which had to be in correct proportion to one another. Though virtually worthless as a theory, it remained the fundamental belief of European medicine for over 200 years. They correlated with the four elements proposed by Aristotle and even with the four seasons. There are many different types of pictures you can find on the web that show the same information as the one I show here, but in different formats. Feel free to find alternative pictures of the four humors, elements, seasons, behaviors, and body status, like hot, cold, moist, and dry. Basically, if a person had excess yellow bile, this was a problem with their liver and or gallbladder, and the person would present with skin that was hot and dry, and they were considered choleric. If a person had a problem with their blood, this was a problem with the heart, and the person would present with skin that was hot and moist, and they were deemed sanguine. A person who had a problem with their phlegm had a problem with the brain and lungs, and the person would be cold and moist. A person who had too much black bile had a problem with their intestines, and they would be cold and dry. Anytime a person had a humor that was out of balance, for example, if a person had excess yellow bile, then the physician would try to increase the opposite humor or reduce the one that was in excess. In this case, the humor opposite yellow bile is phlegm, so the person would be advised to eat fish and take cold baths. Another example would be if someone had excess yellow bile, the physician might prescribe an emetic to induce vomiting. If the person was melancholic, then black bile was to blame, and so they were given a laxative. In the person who had too much phlegm, they were cold and moist. In an effort to reduce this humor, the ill person was told to avoid fish because fish are associated with water. Additionally, they were told to bundle up and drink wine and eat pepper so that they would sneeze and cough more to get out their phlegm. A person with the flu, of course, would have a fever, dry sore throat, and so they would be deemed hot and dry, and therefore the culprit was the liver and yellow bile. Accordingly, these people were told to take cold baths. Cold, moist is opposite from hot, dry. And it is interesting to note that in Elizabethan literature, Shakespeare oftentimes refers to these four humors in his works. Can any of you remember your Shakespearean literature and give examples? Just some fun trivia to research if you ever had that guilty pleasure of surfing the net during your spare time. It is important to note that it was the Roman physician Galen that first described the four temperaments that correlated with the four humors and their qualities of hot, cold, moist, and dry. He was revered as a great clinician. I will expand on the four temperaments on the next slide. In this picture, a medieval German woodcut depicts the temperaments of the cold and dry qualities of the melancholic disposition, which were associated with old age, retentiveness, and scholarship, like the old man depicted here with his head resting on a table. In the second image, we see the hot, moist man representing the sanguine temperament and is depicted as an active wooer embracing a woman. In the third image, we see a cold, moist, phlegmatic couple, and they prefer their retirement and leisure, signified here by music. Fourth image, the hot, dry man of color furiously beats the woman kneeling helplessly at his feet. In the human body, the interaction of the four humors explain differences of age, gender, emotions, and disposition. The influence of the humors changed with the seasons and times of day and with the human lifespan. Heat stimulated action, cold depressed it. The young warrior's choler gave him courage, but phlegm produced cowards. Youth was hot and moist, the elderly were cold and dry. Men, as a sex, were hotter and drier than women. The English physician, William Harvey, had dissected 80 species of animals, concentrating on the blood vessels. He noted that the valves joining the heart's two upper and lower chambers permitted blood flow in one direction only. He showed that the heart was a muscle which acted like a pump. He concluded that arteries and veins were linked by invisibly small vessels so that blood moved around the body in a closed loop. Harvey's discovery of the circulation of blood is considered as his greatest contribution to the field of medicine. His many experimental dissections and vivisections made him reject Galen's views about blood movement, particularly the concepts that blood was formed in the liver and absorbed by the body, and then it flowed through the septum of the heart. In traditional Galenic physiology, there were two types of blood, the venous and the arterial, with distinct pathways and functions relating to the three chief body centers: the liver, which was responsible for nutrition and growth, the heart, vitality, and the brain, sensation and reason. Nourishment and growth were secured by the venous blood originating in the liver, while vitality was conveyed to the body parts by the arterial blood originating in the heart. Arterial or life-giving blood contained pneuma, spiritus air. During this time, physicians believed blood fed the body when needed. Being there in the tissues, it would be used up. It did not return to the heart. Given the quite distinct functions of venous and arterial blood, their different sources, and the belief that they were expended, there was no belief that the heart acted as a pump during this era of medicine. Florence Nightingale was not a famous physician, but she is considered to be the founding mother of the nursing profession. She was sent to a British camp to tend for wounded soldiers during the War of Crimea. When she arrived, she was appalled at the conditions of the hospital. Rodents and sewage were all around, and the wounded soldiers, they were around the wounded soldiers spreading disease. Soldiers were dying from secondary infections rather from their battle wounds. Nightingale set to work. She procured hundreds of scrub brushes and asked the least infirm patients to scrub the inside of the hospital from floor to ceiling. In addition to vastly improving the sanitary conditions of the hospital, Nightingale created a number of patient services that contributed to improving the quality of their hospital stay. She instituted the creation of an invalid's kitchen, where appealing food for patients with special dietary requirements was cooked. She established a laundry so that patients would have clean linens. She also instituted a classroom and a library for patients' intellectual stimulation. Her work reduced the hospital's death from 40% to 2%. Nightingale herself spent every waking minute caring for the soldiers. In the evening she moved through the dark hallways carrying a lamp while making her rounds, ministering to patients. The soldiers, who were both moved and comforted by her endless supply of compassion, called her the Lady with the Lamp. And this is why at graduation ceremonies for nurses they oftentimes have a symbolic candle that is lit by all the graduates. Queen Victoria was so moved by Nightingale's work that she had a brooch made for Nightingale. Now let's switch our focus from our brief overview of medical history to the study of pathophysiology. The term pathophysiology is defined as the physiology of altered health. According to the preamble to the Constitution of the World Health Organization in 1948, it defined health as a state of complete physical, mental, and social well-being, and not merely the absence of disease and infirmity. The focus of this class is the study of pathophysiology, the study of the body's response to dysfunction or disease. The definition of disease is an interruption or cessation or disorder of the body system or organ structure that is characterized usually by a recognized etiologic agent or agents, an identifiable group of signs and symptoms, or consistent anatomical alterations. The aspects of the disease process include etiology, pathogenesis, morphologic changes, clinical manifestations, diagnosis, and the clinical course. I will define these topics on the next few slides. The causes of disease are known etiologic factors. These agents can be biologic, such as bacteria and viruses. They can be physical forces, such as trauma, burns, or radiation. They can be chemical agents, like poison or alcohol. They can be nutritional excesses or deficits, and there can be a molecular source, such as in sickle cell anemia, where a gene mutation results in the insertion of a valine amino acid at position 6 instead of glutamate. Most disease-causing agents are not specific, and many different agents can cause disease of a single organ. Most disease states do not have a single cause. Instead, the majority of diseases are multifactorial in origin. Multiple factors that predispose a person to a particular disease often are referred to as risk factors. Physicians like to group agents that cause disease into two broad categories. If the agents were present at birth, they are called congenital conditions. However, their manifestations may not be evident until later in life. Acquired defects are those that are caused by events that occur after birth. In the bottom picture on the slide, you see a man with gross skeletal deformity that he acquired due to a nutritional deficiency combined with exposure to high levels of fluorine from domestic coal combustion. Pathogenesis is the sequence of cellular and tissue events that take place from the time of initial contact with an etiologic agent until the ultimate expression of the disease. Morphology refers to the fundamental structure or form of cells or tissues. Morphological changes are oftentimes part of the pathogenesis in a particular disease. This is actually going to be brought up again in a lecture on cellular adaptation and injury. I have a picture here of the Hangover trailer, and for me, I like to think of pathogenesis as the events in this movie. Pathogenesis means that you have to backtrack a bit, just like the gentlemen had to backtrack once they woke up the next morning from their bachelor party. When they woke up, there was a lot of evidence in the hotel room to suggest that they had a wild and crazy night. They also realize that their friend is missing, so they have to retrace their steps to go back to the initial time when they realized that their cocktails had been spiked with a drug. The drug was the etiologic agent, and all the events that led up to their missing friend could be considered the pathogenesis. Clinical manifestations are also aspects of the disease. When we think of clinical manifestations, we think of signs and symptoms. A symptom is a complaint that is given by the person or patient with the disorder, whereas a sign is a manifestation that can be observed by the physician. For example, having difficulty in breathing and dizziness are symptoms of the disease. These would be complaints the patient would give the physician. An elevated temperature that can be measured, a swollen extremity that can be palpated, and changes in pupil size are objective signs that can be observed by someone other than the person with the disease. It is important to note that signs and symptoms may be related to the primary disorder or disease, or they may represent the body's attempt to compensate for the altered function caused by the pathologic condition. A syndrome is a compilation of signs and symptoms, and a complication is a possible adverse extension of the disease or outcome of treatment. For example, a complication of uncontrolled diabetes mellitus is the development of sores in the feet, and this is due to poor blood flow and nerve damage. When we think of disease, it is important to understand that the diagnosis is the identification of the nature and cause of a health problem. A physician will take a patient's history and obtain their accounts of their symptoms and their progression of the disease. A physical examination is done to observe for signs of altered body structure or function. Developing the diagnosis involves weighing competing possibilities and selecting the most likely one from among the conditions that might be responsible for the person's clinical presentation. Are you all thinking about your favorite House episode? I'm sure if you've watched an episode of House, you can appreciate all the time and investigative efforts involved into making a correct diagnosis of patient's disease. An important factor when interpreting diagnostic test results is the determination of whether they are normal or abnormal. Normal values for laboratory tests are based on values that refer to the greater 95% of the population, meaning the greater majority of the population presents with a similar value. When we think of tests, we think of validity. Validity refers to the extent to which a measurement tool measures what it is intended to measure. For example, we would not use a blood pressure cuff and sphygmomanometer to measure renal clearance values. When we think of reliability, this refers to the extent to which an observation, if repeated, gives the same result. For example, a spectrophotometer with a faulty light bulb will give unreliable optical density readings. When we speak of sensitivity for laboratory testing, we are referring to the proportion of people with the disease who are positive for the disease on a given test or observation. This is called a true positive result. For example, if the result of a very sensitive test is negative, it tells us the person does not have the disease and the disease has been excluded out. Specificity refers to the proportion of people without the disease who are negative on a given test or observation. This is called a true negative result. A funny example of this would be from my graduate school friend, Dr. Zoe. When he suspected that his wife was pregnant, he would buy 2 pregnancy tests, one for his wife and the other for him to urinate on. The point of that was to demonstrate the sensitivity and specificity of the pregnancy test. It should be sensitive enough to detect the human chorionic gonadotropin and specific enough to not cross-react with other hormones, like testosterone. Of course, we don't think of the pregnancy test as being the pregnancy as being a disease, though I do personally, because the woman is carrying a parasite. But the point of the test was to show that Dr. Zoe's wife was pregnant, sensitivity, and he was not, specificity. To go along with this example, if Dr. Zoe had his wife take the pregnancy test too early in her pregnancy, the test may not be sensitive enough to detect the pregnancy hormone, and this would have led to a false negative result. The health of individuals is closely linked to the health of the community and to the population it encompasses. Diseases that were once confined to local areas of the world now pose a threat to populations throughout the world when we consider that people can traverse continents in a matter of hours. Epidemiology is the study of disease occurrence in the human population. Epidemiologic methods are used to determine how a disease is spread, how to control it, how to prevent it, how to eliminate it. Can any of you tell me what is now currently happening in Orange County that is an epidemiological nightmare? Are you thinking Disneyland? Measles? Perfect example of why we're studying pathophysiology and how to contain and eliminate the spread of disease. Measures of disease frequency are an important aspect of epidemiology. Disease incidence reflects the number of new cases arising in a population at risk during a specified time. For example, 10 new cases per 1,000 individuals per day. Prevalence is a measure of existing diseases in a population at a given point in time. For example, yesterday, 100 people out of 1,000 total had the flu. Today, 110 per 1,000 people. Incidence and prevalence are always reported as rates for example cases per 100 or 1,000. Morbidity and mortality statistics provide information about the functionality impairment on the body and death-producing characteristics of the disease, respectively. Mortality statistics provide information about the causes of death in a given population. Morbidity describes the effects an illness has on a person's life. To relate morbidity and mortality to a disease state, I found this cute little cartoon shown here on the screen. It shows a person who is stressed. You will learn that long-term chronic stress can lead to cardiovascular disease. Stress has a high morbidity, but not necessarily a high mortality rate. Stress certainly impacts the quality of life of a person, but rarely does a person die from stress. For example, you're studying for a pathophysiology exam certainly impacts your quality of life, but that does not necessarily cause you to stroke out and die. Another example your textbook uses is arthritis. People with arthritis have low mortality from the disease, but arthritis certainly has a significant impact on the quality of their life. It has high morbidity. When epidemiologists consider prevention of disease, there are typically 3 levels of disease prevention. Primary prevention is directed at keeping disease from occurring by removing all risk factors. For example, when a woman is pregnant, we would like her to be on a prenatal vitamin that is high in folic acid and vitamin B12. These vitamins are required for DNA replication. A deficiency of these can lead to neural tube defects in the child. Immunizations given to children and the elderly populations with compromised immune systems are also designed to help prevent communicable disease. Hello, MMRs, our problem right now. Secondary prevention detects disease early when it is still asymptomatic, and treatment measures can cure or stop it from progressing. For example, when a woman goes in for her annual well woman exam, a pap smear is done for early detection of cervical cancer. Another example of secondary prevention would be a blood pressure measurement during an annual physical examination. It would detect hypertension, and the patient can be counseled for changes toward healthier lifestyle techniques. Tertiary prevention is directed at clinical interventions that prevent further deterioration or reduce the complications of the disease once it has been diagnosed. For example, chemotherapy would be an example of tertiary prevention. The chemotherapy targets rapidly dividing cancer cells and is used to hopefully halt the invasive nature of the cancer to surrounding healthy tissue. Well, that concludes our brief history of medicine and our first lecture on some vocabulary that we will use throughout the semester.